Hello, dear friends. This is Sofya Dorinskaya with you, President of the International Bureau for Human Rights in Mental Health and head of the Sofya Dorinskaya Center for Medical Information. Today, I will tell you about the safest nootropic remedy, which unfortunately for some reason has been forgotten, discarded, or removed from view. And to be honest, because of this, people, patients, in fact, medicine as a whole, have faced major problems. So let's look at the sequence of actions. How does it happen that, for example, children with intellectual difficulties are prescribed neuroleptics? This is the sequence that I have discovered. A child comes in with various intellectual impairments or with some school-related problems, and the doctor, so to speak, out of the goodness of their heart or based on their own judgment, out of a desire to help, prescribes nootropics to this child. What side effect do we very often see with nootropics? It's aggression. We see this effect in children. We see this effect in elderly people as well when they are prescribed nootropics for various cerebral circulation disorders. And then when aggression begins, the person is prescribed behavioral correctors in the form of neuroleptics. I even made a video about this. A father went to an appointment with his son who was later prescribed nootropic drugs, and the father himself started taking these nootropics. This video exists, you can find it. And the father suddenly noticed while taking this substance together with his son that at the same time as his son, he also began to develop aggression, both the son and the father. The father went to the doctor and said, listen, both of us are taking this nootropic and we're both experiencing aggression. The doctor actually just brushed it off. And what are we seeing now? People are basically being bombarded with neuroleptics like cockroaches with dust. Now, even young children are being given neuroleptics, elderly people with severe conditions are receiving neuroleptics, and people of working age are being put on neuroleptics because of some mood problems. They are prescribed nootropics, and again, neuroleptics can be prescribed to them as correctors. And in general, with neuroleptics, you need to be absolutely clear. These are neurotropic poisons. They are legal narcotics. And in fact, our population is starting to be handed out these legal narcotics while being told how they treat the brain. So let's remember today about a completely natural, absolutely safe, and fantastically effective natural nootropic that exists on planet Earth. This is nicotinic acid, vitamin B3 or vitamin PP. Nicotinic acid in the form of niacin. There is another form as well, nicotinamide. This is nicotine. This is vitamin B3, from which the effect, that very redness, has been removed, meaning its action on peripheral blood vessels. So today I will be talking about real niacin, about nicotinic acid, the one that causes that very redness for a short time. And in fact, the effect of taking nicotinic acid is simply fantastic. Let's start with the fact that there is a deficiency condition, a deficiency of nicotinic acid, vitamin B3, called pellagra. And unfortunately, pellagra has now changed its clinical manifestations because what we read in all the textbooks from the beginning of the century or even the middle, the 1950s, about how pellagra presented itself, you unfortunately are unlikely to see that now. Why? Because the composition of food has changed, the composition of water has changed, the composition of the soil has changed. In terms of minerals, the elemental composition of the soil overall has changed. And naturally, everything that now grows on the earth, as I understand it, has a slightly different chemical composition than it did at the beginning of the century. There are a lot of medications nowadays. And if, for example, a person develops pellagra spots in the form of simple peeling around the eye sockets, they are prescribed a zinc ointment. This goes away and it is considered as if, well, that's it, we've cured it, right? But in reality, this is a manifestation of vitamin B3 deficiency. Let's recall what the symptoms of vitamin B3 deficiency are. What is pellagra, the 3Ds? It's dermatitis, diarrhea, and dementia. We very often see dermatitis in people, in children with features of the autism spectrum, or with autism already, or with intellectual disabilities. Almost all of them have gastrointestinal dysfunction and naturally impaired intellectual functions as well. So, dear neurologists, forgive me for the banality, but honestly, before you start using all these heavy artillery drugs like nootropics with their side effects or phenibut, which drug addicts take several tablets of to get that narcotic high, right? You prescribe it to children. So let's remember that we have nicotinic acid, vitamin B3, and you simply start prescribing it to the child. And believe me, the magic of change won't take long to appear. Just remember, please, that the absolute minimum course described is 3 months. Described, right? That is, it needs to be prescribed for a long time, especially when we already see pronounced changes. For example, when there is already intellectual disability or signs of autism. So please, you prescribe from 50 to 100 milligrams. Yes, if at the start of taking it there is a strong rash and the person becomes very red and it bothers them, then fine, lower the dose at first, let them stay on that for 10 days, then you can increase it, then 50 milligrams in the morning and during the day, and that's it. This is an absolutely fantastic thing. This is an absolutely unique substance which is completely safe when used in standard doses of 50 or 100 milligrams and taken per OS, as they say, yes, by mouth. That is, if we're talking about this, I'm not referring to injectable use right now, because all injectable uses of vitamins are therapeutic procedures and we're not discussing them here. Where else should nicotinic acid be used? Nicotinic acid has a completely natural anti-atherosclerotic effect. It lowers cholesterol levels in the bloodstream. I have an acquaintance who was diagnosed basically with this hypercholesterolemia, and he was prescribed medication. And I just know that he had a problem, that he became dependent on them, meaning he now has to take them constantly. So nicotinic acid is an absolutely natural substance that lowers cholesterol levels. And nicotinic acid must be included in all protocols, standards, I don't know, like clinical guidelines for cardiovascular system pathologies. It absolutely must be used for people with trophic ulcers in diabetes, because that very effect of working with the peripheral circulatory system, when substances finally reach the extremities. Yes, these are the trophic ulcers that people with diabetes suffer from, and this has also been forgotten. Unfortunately, I also haven't seen, and I still don't see, that people are being prescribed this thing. So let's remember about this. It is used for angina, for cerebrovascular disorders, for obliterating endarteritis. Smokers who suffer from this, please, nicotinic acid, you can use it. For facial nerve neuritis, for various intoxications, for diseases of the gastrointestinal tract of any kind. After all, again, if you think that a dose of 50 milligrams is too high for the current condition, let the person split the tablet in half. I have a case. We divided a 50 milligram tablet into 4 parts and the person is using it. So you are introducing a person, so to speak, into this regimen of taking nicotinic acid. And please, I hope that this video, for those who didn't know, will in general give some guidance to read up on this, right? Those who have forgotten will remember. And let's bring a definitive and final halt to this utterly harmful and deeply destructive practice of prescribing nootropics and then antipsychotics to every single patient without any form of careful discrimination. After all, understand that a child who is on antipsychotics, this is truly frightening, because such a child is essentially condemned to intellectual disability. No nervous system can develop under toxic exposure. And what awaits this child is disability, severe disability, and early death. So why do this when instead of all these various nootropic drugs, you could prescribe them nicotinic acid? The minimum duration of intake is 3 months. I can say from my own experience, nicotinic acid in the usual dose of 50 milligrams can actually be taken for years. Dear people of middle age, if you want to prevent dementia in your later years and in old age, start taking nicotinic acid. If you suffer from migraines, if you have headaches caused by spasms of the brain's blood vessels, I have a video about this. Start taking nicotinic acid. Gradually, you'll adjust, you'll start taking it, and over time, your body will regulate this system because nicotinic acid is an absolutely natural substance. It's absolutely impossible to harm yourself with it. But, common sense should never be ignored. Of course, you can even poison yourself with water. If you eat 250 milligrams of salt at once, you can get poisoned by that too. So you shouldn't buy a box of nicotinic acid and eat it all at once. I'm talking about normal common sense, about sensible use of the substance. Yes, 50 to 100 milligrams per day. And my experience, my practice shows that even elderly people start to feel better. And of course, our little clients, the parents are just showering us with gratitude. Really, truly, people say that their condition changes. So here it is, here is the core, here is the root. My friends, please remember such a substance as nicotinic acid. Please, if you are currently undergoing active treatment, if you have diabetes or cardiovascular problems, tell your doctor about this. I do not believe that anyone would have a reason to object if you decide to add nicotinic acid to your daily regimen. And you will find that slowly but surely, the overall situation will begin to show signs of improvement. Because nicotinic acid, much like all other essential vitamins and minerals, is essentially a form of vital food and fundamental nutrition. And when we help the body in terms of providing these necessary nutrients, well, improvements tend to occur quite gradually over a period of time. That is, you need to give the body some time to eliminate deficiencies, possibly to build up certain reserves, and gradually adjust its systems. But all these transformations and the various improvements that come from these nutrients, what is the real benefit of it all? They are very reliable. I hope this video was helpful. I hope that my colleagues, neurologists, pediatric neurologists, child psychiatrists, who really, I know that most of you truly aim to help your patients. Prior to the moment you decide to initiate this aggressive pharmaceutical attack on a person, you should first begin the process of treating people with nicotinic acid to ensure their safety. Believe me, your reputation as a skilled doctor will precede you. This was Sofya Dorinskaya with you. All the best. Goodbye.